الله الرحمن الرحيم. أعوذ بالله من الشيطان الرجيم. Welcome back. The next sign is soft tissue swelling. This sign may be seen associated with fracture. You can see a soft tissue swelling around the area of the fracture, and sometimes you cannot see the fracture, but you can see the soft tissue swelling around the traumatic area, and this give your attention in there is a fracture. So soft tissue swelling may be a valuable guide to presence of underlying fracture. And sometimes because fracture becomes subtle fracture. لكن this soft tissue swelling تلقى soft tissue density around the of the fracture site. This can guide you to the fracture. Also, joint effusion may be a sign of fracture, and this joint effusion have a very important sign which is called bad sign positive. What is bad sign? If you look to this is the cortex and this is the cortex. Adjacent to the cortex there is a fat density, normally seen close to the cortex. Follow this density just near or close to the cortex on both sides, medial, posterior and anterior. But at this point the fat is displayed. لاحظوا الخط ضيق. fat density دي normally should be close to the cortex till down. لكن if you follow it, it is at till this point the fat density is against the cortex, but from here it is displayed. لاحظوا الخط الأسود ده الفات المفترض normal يكون close to the bone, displaced anteriorly, and also in the posterior aspect. If you go, you can see this density. This is the fat density, also displaced posteriorly. And what is the cause of displacement of this fat from its normal position? Is due to accumulation of fluid. يعني في fluid جمعت هنا. This fluid displays this fat. عملت pushing from its normal position لأنه حصل accumulation of fluid, joint effusion, pushing the fat from its normal position. So this is called positive fat path sign. Also the posterior fat is displaced posterior due to fusion in this area. The presence of this effusion is indicating that there is a fracture. لذلك you have to look to the bone very. You have to review the X-ray for this patient present with trauma to diagnose the fracture. لكن till now in this lateral view there is no obvious fracture. لكن presence of this positive fat band which indicate fusion, it is a strong indicator for presence of fracture. So you have to review this film carefully, and if you do not see the fracture, you have to order or request other view. This fracture may be appear in other view. You can do مثلا AB and oblique. But this is oblique view done for the same patient. This is oblique for the same patient. You can see this line. This is a lucent line at the head of the radial. This is a radial head lucent line. Fracture line اللي هو lucent. لكن in this lateral difficult to see this line. لكن وجود الفيوجن دي خلانا نفكر لا there is a fracture. You have to review the film carefully and to look for the other film to identify the fracture. كان اتكلمنا على sign of fracture. Please put this sign always in your mind when you looking for the patient present with trauma. يعني sometimes the fracture may be very obvious, very clear. دي ما في مشكلة. لكن if the fracture is subtle, this sign help you in identify the fracture. Lucent line, dense line, step in the cortex, alteration of normal articulation, soft tissue swelling, and joint effusion. Joint effusion sign is displacement of the fat part. ما positive fat part sign. Stress fracture is the fracture that occurs in the normal bone. يعني البون بيكون normal due to repetitive activity. وبيحصل لنا due to repeated activity on the normal bone بيحصل لنا fracture. This is common seen in the facilities and also in the soldiers يعني in the training يعني اللي هو العسكري يعني. And it is common seen in the tibia and fibula and the metatarsal bone, especially in the metatarsal bone in the مثلا in the marisoners or in the حتى in the soldiers. Yeah, it is commonly seen in this metatarsal يسموها المارش fracture. So the tibia and fibula and metatarsal are the common site for the stress fracture. أهم شيء البون normal لكن due to repeated activity بيحصل لنا الفراكشر دي. طيب what is the clinical presentation؟ البيشنت بيجي بإيش؟ بيشكي بشيء. مشكلته بيجي يقول عندي pain. This pain increase with activity and relief by rest. Relief by rest and increase by activity. And there is a tenderness with pressure, with palpitation, there is a pain. So there is a tenderness. But this is a clinical presentation. How to diagnose this stress fracture؟ أول شيء طبعا إحنا patient جاكل عنده pain with activity relief by rest وهو لقينا مثلا كسولجر او ماراثون بيفكر في الستريس فراكشر. طبعا عملنا اكس راي. طبعا you have to start with plain x-ray. Unfortunately this plain x-ray usually normal if it was done especially before 2 to 3 weeks. يعني if it done in week 10 day 10 day 8 يعني up to 2 weeks this X-ray usually normal show nothing كأنه ما في أي شيء normal radiograph normal X-ray no signs of fracture no abnormality detected in this usually. This is a report usually. لكن if done later after 2 to 3 weeks the plain X-ray may demonstrate the fracture. توقعوا ليش؟ How to explain this؟ والبيشنت قاعد fracture من day 2 or day 1 طبعا fracture. لكن day 1 day 2 day 3 till 2 weeks or to 3 weeks the fracture at this time may be seen on the plain X-ray. Why? What is how to justify?
calcification.
Yes, there is a calcification. لأنه طبعا زي ما عارفين إنه أي fracture healed by callus formation and calcification. فبيحصل لنا calcification as the area of fracture. This pay your attention or attract your attention إنه there is a fracture here and you miss it. مش you miss it يعني due to إنه أنت ما شفته. due to no يعني no fracture line. فبيحصل لنا calcification اللي هو بيقول بيوضح لك إنه كان في fracture at this area. Within this calcification you can see the fracture line. Sometimes you can see the fracture line within this calcification. طيب إذا patient جاب suspected stress fracture إحنا عملنا plain X-ray is there any طبعا إحنا زي ما اتكلمنا إنه radioglide bone scan very sensitive for detection of fracture within 2 to 3 days. أو عندنا ال MRI also is very sensitive for detection of stress fracture. هل نحن إذا البيشنت جا suspected stress fracture نعمل له radionuclide or MRI for early detection of this fracture? This depends on the risk of the fracture. يعني إذا الفراكشر in the مثلا in the metatarsal أو إذا كان في الميتاكاربال بون، يعني this is not carry risk for the patient. You can wait and repeat the X-ray 10 days to 14 days. لكن إذا كان الفراكشر ده in the high risk region مثلا كان the pelvis or hip، لأنه it could be increased with activity، فلذلك you have to diagnose this fracture early for early management. So you have to do either MRI or radionuclide bone scan. And طبعا لأن الراديوكلايد بون سكان برضه فيها hazard radiation وكده usually we prefer MRI. Although this radionuclide bone scan can demonstrate this fracture. لذلك احنا ما بنعمل ال other option دي ال MRI or radionuclide for the low risk fracture. لكن ننتظر ونعمل plain X-ray إذا كان البيشنت still symptomatic. The patient's symptom حتى relief, no need for further assessment. لكن إذا the fracture is in the high risk region, you have to assess this fracture as quick as possible. So MRI is recommended for early diagnosis إذا كان here because it is a high sensitive and high specific for detection of this stress fracture. طيب بنشوف ايش by the MRI you can see the fracture line and you can see any damage to surrounding tissue and edema. تلقى ال fracture line يكون hypo intense. هنيجي نوضحه إن شاء الله. إذا زي ما قلنا برضو أيضا can do bone scan red nuclear scintigraphy also can diagnose this stress fracture and differentiate this fracture from other cause of pain. And patient كان عنده pain أكيد هنشوف what is the cause of this pain. طيب how the fracture appear on radionuclide bone scan?
Uptake, increased uptake.
Increased uptake. تلقى المنطقة very dark, very black. This is called increased uptake. زي ما قلنا plain X-ray هتكون normal، لكن you can do MRI which demonstrates this fracture as the line, or you can do radionuclide. But this is plain X-ray for the patient present with can soldier or can marathoner who present with foot pain. And this is a film done in the نقول day 2 or 3. Do you see any abnormal in the film A for the patient foot? On examination, there is a tenderness as the second metatarsal, the base of the second metatarsal. This patient presents with foot pain, no other. On examination, there is a maximum tenderness as the base of the second metatarsal.
Doctor, is it for picture A or B?
The picture A, yes.
Maybe at the medial border of the second metatarsal. Yeah.
There is a يعني خط خفيف كده اللي هو شنو hair line كده لوسن، لكن difficult. It can be missed. يعني حتى not clearly demonstrated. إلا تركز شديد كده إنه في شنو you can magnify the image. You can see there is شنو هنا بالضبط هنا يعني here there is a line خفيف جدا يعني it can be missed easily in this region. طيب what do you see at the same side in the picture P? This is the X-ray for the same patient done 2 weeks later. Compare between the two, the same side. Compare in the base of the second metatarsal in the image A and image B. be. What is the difference? Is there any difference in appearance of the base of the
It's are
second?
opaque.
Yes,
More
it
opaque on
appear
the
opaque. So yes, why is this? In this there is opacity. Why is it appear
due
opaque
to the
like this?
calcification إنه healed يعني.
Calcification حصل color formation healing. So this pay your attention إنه there is a fracture here missed in the first film. يعني إذا كان دي reported as normal نعرف إنه هنا there is شنو fracture. There is a fracture, all fracture بقى يعني بقى healed. So this is a شنو stress fracture. So usually this is a scenario for the stress fracture. But if you do MRI or radioclide, it can be diagnosed earlier. And this is a radioclide bone scan for the patient present with pain in the leg. Pain in the leg. What do you see?
Abnormal uptake.
Yes, abnormal increase uptake. Yes, there is increase uptake. Increase لأن في condition طبعا بعتقد نجي نوضح لك في condition associated with decrease uptake. يظهر in the bone not common يعني لكن في many conditions can present with decrease uptake. But there is this is of the more hot spot increase uptake. if this patient يعني evaluated by plain X-ray it may be normal. يعني إذا كان عملنا له plain X-ray it may be normal or usually normal يعني if done before 2 weeks. But there is an increase uptake. What is this exam?
X-ray.
X-ray of what?
the ankle lateral view.
Yes, or the ankle lateral view. What do you see? What يعني what do you see? What abnormality do you see which is demarcated by the arrow? This patient present with
Sclerotic.
yes, there is sclerosis. Yes, there is sclerosis. If this patient present with pain, foot pain, and it is a marathoner, what do you suspect?
Stress fracture.
Stress fracture. طيب, do you think in this X-ray done early or later?
Late.
ليش? Why?
Because يعني started healing.
Yes, because it's starting healing. If it's done earlier, there is no healing, there is no calcification, there is no colors, and it will be normal, يعني appear normal. This is MRI for the other patient present with foot pain, and you can see this line. How to describe this line in MRI terminology?
Hypointense.
Yes, there is a hypointense. This line is hypointense, but this is a هو حصل سكليروزيس. دائما الكالسيفيكيشن appear hypointense, but this is a calcaneal stress fracture demonstrated by this MRI. Pathological fracture تقريبا درسناهم له في البلوك.
طب دكتور.
Yeah.
بس ممكن سؤال على why is there increased intensity around it طيب?
Increased intensity around this.
Yeah, on the other image, on the left.
This is due to edema. This is due to edema.
Okay, so it's T1.
Yeah. This is here this tier يعني this is a T1 لكن ده other protocol يعني أنا ما تكلمت عنه. this tier قريب لل T2 يعني. الفلويد appear يعني hyper intense كده شوية. إذا إديمة لاحظ الإديمة إن T1 بتكون شنو؟
دارك
زي دي. and this is the يعني أو دي هي ممكن تكون T2 ستار، يعني ما T2 اللي بتعرفها. يعني هو طبعا البروتوكول كثير، السيكونس كثيره، لكن this is a fluid يعني. fluid appear hypointense in T1 hyperintense in T2 and ده هو حاجه اسمها T2 ستار يعني هي قريبه لل T2 يعني. ممكن تقول عليها زي ممكن تقول عليها T2 انتوا الحين يعني. لكن شنو زي ديما يعني لكن good observation انه why this appear hyperintense and this is a edema or fluid يعني. Pathological fracture is the fracture that occurs on a background of unhealthy bone. Anyone to comment on this image or the bone in this image? Ignore this abnormality. The
Trabeculation is
yeah.
a problem in trabeculation. Trabecular pattern interrupted.
Yes, abnormal trabecular pattern is altered. Yes, what else?
Lytic lesions.
Yeah, thank you. What are lytic lesions? What do you mean by lytic lesion? You are right.
Decreased bone density in local areas.
Yes, there is a focal decreased bone density. This is focal decreased bone density. This is focal decreased bone density. But there are multiple lytic lesions. This patient is known case of CA breast carcinoma of the breast. So what are these multiple lytic lesions?
Metastasis.
Yes, represent metastasis. So this bone is unhealthy. This bone is weakened by the metastasis. So with mild trauma, this patient may develop fracture. فلذلك حصل له this fracture. فبنسميه شنو؟ pathological because it occurs in abnormal weakness bone, weak bone, abnormal weak bone. due to underlying pathology اللي هو حصل شنو عندنا secondary metastasis دي. احيانا ممكن نلقى patient عنده bone cyst. As the site of the bone cyst يحصل له fracture، برضه نسميها pathological fracture. So pathological fracture is the fracture that occurs in background of unhealthy bone due to any bone disease, metastasis, or neoplasm, cyst, and so on. College fracture also has been discussed in the MSK block occurring the result of outstretched hand. هو طبعا common fracture happening in the elderly after falling on outstretched hand. And this fracture characterized by fracture of which bone?
Radius.
Which
Distal
part, distal and the metaphyseal, distal radial. What about the angulation? The distal fragment is angulated. Is it angulated posteriorly or anteriorly?
Posteriorly.
Posterior. Look to this angle. But this dorsal angulation or posterior angulation of the distal fragment. يسموه deformity، يسموها شنو؟ inner fork deformity. If you look to the X-rays for this patient, how to interpret this X-ray? Well, what is this and what is this, and comment on both. Diamond, to report the X-ray, you have to mention first the exam. This is مثلا chest X-ray. They have to contrast مثلا كده technique.
Plain X-ray of the arm.
Yes.
Oh, of the wrist. Sorry.
Yes. Which view? This one.
Anterior, posterior.
Yes, and this one.
Lateral view.
Lateral. Yeah, thank you. This is. Then you have to describe the abnormality. What do you see? Description, not the diagnosis. You have to mention diagnosis.
Step in the cortex.
Yes, there is
the distal radius.
Yes, there is a step in the cortex.
Lucent line.
There is a lucent line, yes. And what else? There is alteration also. Some alteration of the normal but also yes, I agree there is a lucent line and a step in the cortex in the which bone in the
distal radius.
طيب اتكلمنا عن angulation our switch side. طبعا angulation never difficult to be seen in what? In AB. To assess the angulation you have to look to what? To lateral. Angulation هنا difficult to be seen لأنه الangulation هي either anterior or posterior. You have to look to it from the side يعني. لكن هنا angulation not seen. طيب what is the angle? Where towards which side the distal bone is angulated? Look to this is a posterior and this is anterior. And this is yes, it is angulated posterior. Look to this angle. There is a posterior angulation. So this is a Colles fracture. The reverse Colles fracture يعني عكسه تماما is other fracture called Smith fracture. This is Smith fracture. إذا أنت نظرت لل AP anterior posterior view typical similar to the Colles fracture. No difference. Both occur in the distal radius. لذلك إنه to differentiate between them you have to look to the lateral. And this is the AB X-ray for the wrist. You can see the step in the cortex and there is alteration in the normal trabeculation pattern. There is alteration. There is no this abnormal. حصل المنطقة دي تحس بها كده not homogeneous like this. وفي step in the cortex very clear. To assess the angulation you have to look to the lateral. This is anterior aspect. This is a ventral and this is a dorsal. So this angle is angulated anteriorly. The distal fragment and angulated anteriorly. So بنسميها reverse Colles fracture. عكس الكولس fracture. يعني الكولس fracture بتكون posterior. Angulation posterior in the distal fragment. But this is a Smith fracture. طيب what is this exam?
Plain X-ray.
طيب what is this bone?
Metacarpal. I'm not sure which one. اللي
Yes.
medial.
Yes, metacarpal.
First one.
And what is this?
Hamate.
Yes, hamate. And what is this?
Lunate.
Are you sure? Yes, lunate.
Yes, lunate.
Yes, and what is this?
Scaphoid.
Yes, and what is this?
Triquetrum.
And what is this?
Pisiform.
Yes, thank you. But do you see any abnormality?
There's a
Yes.
space between the scaphoid and the lunate.
Yes, there is increased space between the lunate and scaphoid. But this is due to scapuloneate dislocation. There is a dislocation. فدي sign بيسموها تيري توماس توث sign. تقريبا هو ممثل ولا كده عنده absent tooth. One of his teeth is absent. فبيسموها sign دي تيري توماس توث sign. This is indicating there is a rupture of the ligament between the scaphoid and lunate. Scapuloneate dislocation. What is this exam?
Plain X-ray.
Plain
The
X-ray of
pelvis.
the pelvis. What striking abnormal do you see?
A fracture.
Fracture. Which bone is fractured?
The ischium or Ischium and part of the
يعني هو
pubis.
يس بيسموه ايش لكن دي؟ This is superior what? This is a pubic bone. This is superior pubic
I don't remember.
ramus, and this is inferior pubic ramus. This is superior ramus, and this is inferior ramus. And this both are pubic rami. There is a fraction in superior and inferior pubic ramus. What is this? This دي يسموها ايش؟
Obturator foramen.
obturator foramen. طيب look انه في عندنا حتجينا ساين كده مهمه اللي هو اسمها شانتون ساين، هنتكلم عنها، لكن لانه this is normal فلاحظ انه we draw a line from the medial aspect of the obturator foramen and then go to the medial end of the neck of the femur. لاحظ انه هنا دي بتكون كده شنو اللاين، يعني كانه ده نعمل شنو arch. Look to this appearance. This is normal. عندنا شانتون line then extending from the medial border of the obturator angle go up and to the medial end of the medial border of the neck of the femur. فبس المهم اعرف بين الشكل ده كده بكون well aligned كده، وكده برضه هنا well وكان عاملين تعمل arch كده. فتذكر الصورة دي ان شاء الله هنحتاج لها يعني. طيب السالتر هاريس طبعا برضه درسناكم له تقريبا very easy، وك classification for fracture of the long bone in the pediatric. This used for assessment or classification of the fracture in the long bone in the pediatric age. فمعروف ان البون في البارت بتاعته تكون عارفه الابيفيسيس والكروس بليت and metaphysis. This is the epiphysis and this is the cross plate and this is the metaphysis. Number 1 is the metaphysis, number 2 is the cross plate or physis يعني, and this is the epiphysis. The fracture can involve the metaphysis or epiphysis or both, and can involve the epiphysis, the physis or cross plate only. According to involvement of this part, we classify the fracture. فأول شيء this is a normal. You can see the cartilage within the physis or epiphyseal plate. On the X-ray appear this يعني بتكون space open space. نشوف البون لكن دي بتكون open space اللي هي epiphyseal plate or cross plate due to presence of cartilage. In the Salter Harris type 1, the fracture go through the cartilage الموجود in the epiphyseal plate or physis. بيحصل fracture through this cartilage. لذلك السبيس بيحصل لها widening. space بيحصل widening زي دي يعني. This is Salter Harris type 1. هو fracture through the physis, the epiphyseal plate or cross plate. To increase the distance or the space in this region. لكن the metaphysis and epiphysis are normal. No fracture line not involved by the fracture. In Salter Harris type 2, the fracture go through the physis and extended upward. يعني هيكون عندنا fracture in the metaphysis, but the epiphysis is normal. But this is type 2. In type 3, the fracture involving the physis and extending downward into the epiphysis. But this is type 3. In type 4, the fracture cross through all the metaphysis, the fracture in the metaphysis, and then go through the physis or cross plate and then through the epiphysis. But this is type 4. So what about type 5? Any volunteer?
Insufficiency or
crushed between. كأنه crushed يعني صاروا pushed together. crushed.
angle حصل لها crush. لاحظ compare between the cartilage here and cartilage here is crushed. حصل لها crushing. فلذلك إذا عملنا X-ray, what do you suspect in the plain X-ray for this patient in type 5?
Sclerotic line.
Why?
Overlap. Okay.
Yes, إذا عملنا X-ray normal زي دي، لكن دي حصل crushing of the cartilage. What do you suspect? إذا فكرت بسيط كده كان
No
yes.
chain.
حصل crushing معناته حصل إيش في المنطقة دي؟
injury.
Calcification.
calcification. Why calcification؟ حصل crushing في المنطقة دي. What about the space? This is space.
Decreased space.
Yes, reduce.
Space.
حصل لك reduction، بيحصل crushing. كله هيبقى المنطقة دي compressed كده، فيبقى شنو هيحصل؟ On the plain X-ray will be there is a reduction in the visual plate or cross plate. نجي نوضح الكلام ده. Which one of these is more aggressive? Which type is more aggressive and why?
4. 4, yes.
Or
Yeah. And
why?
involve all of them.
Yes. Is there any other suggestion or other opinion? طيب هو child ذكر انه child بيحصل له growth
مفهوم.
دائما. Yes, type.
ممكن 5 دكتور.
Yes.
لأنه
Why type 5?
Yeah. He can't
Yes.
grow anymore.
Yes, هيحصل شنو؟ ده growth will be
التوبون
aggressive.
حيصيروا مع بعض صح؟
نعم.
السبيس حيصير لها decrease، والتوبون لما يصير في growing حتصير ما حيصير في space.
Yes، ما حيصير
حيصير في
growth ثاني.
calcification.
لأنه
أيوة.
growth بيحصل في الكارتل دي، حصل لها crashing دي، خلاص ثاني ما حيحصل لنا growth. The growth will be arrested. So this is the most aggressive one. لكن الباقي ده ممكن يعمل له fixation، يعمل له شنو fracture دي، لكن هنا بيحصل crushing of the cartilage. So this may lead to يعني stoppage or arrested the arresting of the growth. So it is very aggressive. طيب how to classify this fracture according to Salter height?
1.
type 1.
Why type 1?
Only the physis is affected.
Yes, physis is affected by increase the distance، يعني space bigger more space is increased. physis space is increased. normal المفروض تكون يعني تقريبا زي دي كده، هنا increase this. this is the type 1. How to classify this fracture? I mean this one, not this. أول كويس قبل ما نمشي according to Salter height، what is the type of this fracture or name of this fracture?
True.
This is a
Green
child.
stick.
This is a green stick. Yes, thank you. طيب how to classify this fracture according to Salter height?
Type 2.
Why type 2? Why type 2? متى نقول type 2?
Physis and
Metaphysis.
Yes.
fracture في الميتافيسيس والفيسيس.
Yes, الميتافيسيس. لاحظوا اللوسنت لاين دي معناتها عندنا fracture in the metaphysis. This is the metaphysis. And in this cross plate or physis. لكن the what is this?
epiphysis.
Physis is normal, not fracture. So this is a type 2. And what is how to classify this according to Dr. Harris? Do you see the fracture?
On the left?
On the left, what? On the يعني which bone? Name the bone or the part
distal.
Medial malleolar.
in the medial.
Lateral malleolar.
Lateral, this one?
This one is medial.
لا
في lateral في كمان fracture.
This is medial.
No, this
لا
is the
دكتور
fibula.
Fibula.
لا
لا.
هو التيبيولا شو اسمه؟
Yes, fibula usually is lateral. The tibia is medial. يعني this is a medial malleus and this is a lateral. Usually the tibia is lateral and the tibia is medial. There is a fracture in which one?
medial malleolar.
Yes. You see the fracture line? This is lucent line. مش؟ So what is the class or the how to classify this?
Type 3.
It's a type 3 because it involves what? The epiphysis. Epiphysis is
Epiphysis.
free. Yes, epiphysis is free. But this is the metaphysis. The metaphysis. So this is the Salter Harris type 3. How about this?
Type 4 involves both metaphysis and epiphysis.
Do you see the fracture line?
Yes,
Yes.
lucent
Lucent
lucent line.
line running across the epiphysis, the plate, and metaphysis. So this is type 4. What about this?
Type 5.
Because there is a reduction in
Uh,
the plate.
yeah.
حصل reduction in the epiphyseal plate. In the epiphyseal plate, this is Salter Harris type 5.
طب doctor, sorry, بس how does that injury يعني occur?
by the غالبا تكون due to يعني الميكانيزم due to falling from يعني higher يعني downward يعني usually due to falling down from higher يعني يحصل compression يعني.
شكرا.
Yes. طيب what is this?
Plain X-ray.
For what part?
Shoulder.
Shoulder.
For the shoulder. What is this bone?
Clavicle.
And what is this?
Head of the
Head of the
humerus.
humerus. And what is this part?
Scapula. The acromion process.
Chromion. Is it a chromion? Acromion بيكون attached to what? To clavicle. حتى بيعمل الجوين ده. What is this joint?
صح. Is it the coracoid? The other one?
Yes, this is a coracoid process, and this is a chromion process, and this joint is called a acromioclavicular joint. This joint, acromioclavicular joint. And what is this cavity?
Glenoid.
It's a glenoid cavity. So this is the normal in AP radiograph of the shoulder. Look to this one. Is it normal?
No, he fractured.
What is the fracture? Where is the fracture?
Head of humerus.
In the head of the humerus. There is a fracture in the. Is it clearly seen? In the neck تقول the head ولا شنو؟ In the neck, this is the neck. Fracture in the neck.
Not clearly.
Yes. طيب is it يعني well seen or where will visualize this fracture?
هو ايش دكتور؟ Where is the fracture?
Maybe radionuclide bone scan should
لا
be used.
الحين في the plain X-ray do you see the fracture well يعني?
No.
Just on the side maybe.
Yes.
Yeah, on the side we can see.
لكن it is so it can be easily missed this fracture. لكن ليش اللي هو it can be easily missed؟ تتوقعوا ليش؟
Because not displaced maybe.
not displaced هو one of the يعني الحاجات اللي بتساعدنا انه لما يكون displaced لانه حصل له شنو؟ impaction. يعني شنو impaction؟ يعني دخلوا في بعض كده، فهي اللي بس بتعرفوا بشنو؟ بالالتريشن زي شنو؟ trabeculation. trabeculation بتكون حاسه انه المنطقه فيها شنو؟ يعني irregularity on the normal trabecular pattern، لكن ما في line. there is no fracture line. so this easily can be misdiagnosed. يعني يكون حصل لنا fracture ويحصل له impaction. impaction يعني two edges تدخل في بعض زي ما بيقولوا. ف although هنا في طبعا في fracture in the شنو؟ in the this is a greater tuberosity and this is a lesser tuberosity. There is a fracture in the greater tuberosity. لكن this is a fracture in the neck can be easily missed. إذا حصل له شنو؟ impaction. مش الفراكشر of the neck. any fracture لما يكون impacted can be easily missed لأنه ما بكون في fracture line. إلا بس اللي بيفيدك إيش؟ تحاول تلوك to شنو؟ alteration in the normal trabeculation pattern. Sometimes you can see step in the cortex. لكن sometimes there is no. لكن fracture line ما في وممكن يكون الشيب بتاع البون كأنه normal. لذلك these signs اللي اتكلمنا عنها very important. طيب what do you see in this shoulder X-ray?
Fracture in the clavicle.
In which part of the clavicle?
No, dislocation of the humerus.
Of the humerus? Okay. This one, how you mean this one?
Oh, sorry, I was looking at that.
The medial
Like,
part?
Yes, in the distal part. طبعا which part is most common to be fracture? يعني in the clavicle يعني.
Middle of the clavicle.
The middle most common. Although this is commonly seen, لكن still the middle part is most commonly fractured. لكن also this can be seen common, لكن still the middle part is most common. طيب this is the distal fragment and this is the الفراجمنت دي الميديال and lateral fragment دي are these fragments are in their place or displaced؟
Displaced.
حصل displacement of this شنو؟ this part اللي هي الميديال part is displaced in superiorly. يعني كان المفروض كانت in place كان بتكون in their both in their normal side، لكن دي حصل لها displacement upward. طيب the other shoulder X-ray demonstrate what the abnormality?
Dislocation of the shoulder.
Yes. لاحظوا هنا مثلا this is the head of the humerus and within the glenoid cavity. This is the glenoid cavity. لكن in this one the glenoid cavity is here and the head is displaced, anterior and inferior. Anterior and inferior. So this is anterior dislocation of the shoulder. As you look, the head of the humerus is displaced inferior and anterior to the glenoid cavity. But this is the anterior dislocation of the shoulder. What do you think about this? What is this bone type in the other
Dislocation of the joint.
Which joint?
Between the clavicle and the scapula.
اللي هو بيسموه ايش؟
Acromioclavicular.
Yes, acromioclavicular joint here is this joint. Like here is dislocated, but this is acromioclavicular dislocation due to tear of ligaments in this joint. But this is an acromioclavicular dislocation. What do you see in this one?
دكتور
Yes.
ليش احنا بنقول dislocation؟ كيف الفرق بين dislocation و fracture؟
dislocation يعني a joint not in place، يعني ما هو any joint formed by two bones or more. إذا كانت two bones not in their place دي معناتها دي dislocation، يعني حصل، يعني زي ما بيقولوا شنو ال abnormal position of the bone that form the joint، يعني not in place. لكن الفراكشر ده بكون البون ذاته حصل له discontinuity، حصل له فراكشر يعني اتكسر هو ذاته. ف this is no there is no fracture. The joint يعني بقى abnormal لأنه the bone that joint the the bones that making the joint are not in their normal place. ف displaced from its normal، لذلك نسميها dislocation.
طب دكتور
Yeah.
dislocation ما بيكون فيها إنه ليوسنت لاين وزي
No.
الفراكشر صح؟
No. No. يعني ديك موجودة في الفراكشر، لكن دي بتكون بس في شنو البون displaced from normal position. يعني مثلا هسه دي acromioclavicular joint، this is the medial end of the clavicle and this is a acromion process. This is a joint. الجوينت أي منطقة بتاعت التقاء عظمتين أو أكثر زي ما بيقولوا. this is joint normal joint. لكن here the medial the lateral border of the clavicle is displaced from، يعني بقى معها الجوين ده ما موجود ده. so this is dislocation. إذا في line زي دي حتى نجي نقول مثلا زي دي هنقول fracture زي دي مثلا. هسه هنا في fracture مثلا. so this is different between، لكن هنا مثلا
Thank you.
الجوين ده الجوين ده in place ما في dislocation here، لكن في dislocation in the other joint اللي هي joint between the head of the humerus and the glenoid cavity. So there is dislocation here, but there is no fracture, no fracture line, no interruption of، يعني ما في other no signs of fracture. What do you suspect
Okay,
in
thank you.
Thank you. What do you see in this one?
Is the
طيب.
orientation different?
Yes يعني this is the head of the humerus is displaced from the normal articulation with glenoid cavity. دي glenoid cavity المفروض normally the head of the humerus تكون in this glenoid cavity. But it is displaced posteriorly. But this is commonly seen in patients with epilepsy due after fits or seizure or after electric shock. patient بيحصل له electric shock fall after falling after electric shock or epileptic fits or seizure بيحصل الديسلوكيشن دي اللي هو you can see there is a displacement of the head of the humerus، حصل له rotation internal rotation the humerus head lack it is congruity of humeral head، يعني بقى not in the place، يعني out of the normal articulation place. ف this is a with characteristic shape، بيسموا الشيب ده light bulb. دي أهم sign احنا بنعتمد عليها in diagnosis of posterior dislocation of the shoulder، يسموها light bulb sign. دي بتشبه لنا اللمبة المستديرة دي light bulb sign دي بيبقى الشكل بتاع الهيومرس هيد بيبقى يشبه اللايت bulb appearance. this is a characteristic sign of posterior dislocation. this is posterior dislocation of the shoulder. طيب اتكلمنا قبل عن اللاين دي، قلنا انه عندنا from the اللي هو الشانتون لاين is a curved line formed by the top of the obturator foramen. يعني لاحظ انه هنا ده بنعمل المفروض يكون عندنا line straight from the top of the obturator angle نمشي لحد ما نجي للميديال end of the neck of the humerus. لو مذكرين الجبال دي كانت normal، لكن here it is interrupted abnormal shape. ممكن نرجع لها إذا ما مذكرينها. So this is a line from the top of the obturator angle تعمل كير بيجي في الميديال border of the neck of the femur. ده المفترض يكون straight كده line دي. This is a Shanton line. بيساعدنا كثير في fracture of the femur, neck and head. لأنه أحيانا بيكون difficult to be seen. لأنه زي اللي بيحصل لي impaction اتكلمنا عنه ده. فذيس is أصل لاحظوا اللاين دي بقى abnormal. بس so what do you see? This is طبعا دي الإكس راي. This is the same X-ray. What do you see in this one? هنا عملنا لكم diagram عشان تعرفوا Shanton line هو الكيرف دي بقى abnormal. Fracture in which bone?
Neck of the femur.
Yes, there is a fracture in the neck of the femur. This is a fracture neck of the femur. طيب in this one, what do you see?
Interrupted trabecular pattern. Wait,
Yes.
which one? Left or right?
You comment on what?
The right one.
The right one. Yes. What do you see?
Lucent line.
Yes, fracture because there is a lucent line. This lucent line running from the what to what? What is this?
Greater trochanter.
Yes. Yeah.
Neck of femur.
Yes. Trochanter.
Greater or lesser trochanter.
So this line running from the greater to lesser يسموه ايه? What is this type of fracture? Is running from the greater to lesser trochanter between the two trochanter. يسموه intertrochanteric. Yes, intertrochanteric fracture. This is the intertrochanteric fracture between the greater and lesser trochanters. So this is intertrochanteric fracture. What do you see in this one?
Also, interrupted trabecular pattern at the neck of the femur this time.
Like, what is your diagnosis or what do you suspect?
Fracture in the femur.
Fracture of the
fracture in the neck of the femur. ده برضه زي ما قلنا لكم ده يسموه compacted يعني حصل له شنو؟ impacted fracture يعني حصل له شنو؟ دخل في بعض كده two also can be easily missed. And in addition to abnormal trabeculation, you can see there is a sclerotic line. شايفين في خط أبيض كده خفيف هو. Also this line due to شنو؟ الامباكشن دي. الامباكشن التو بارت لما يحصل لهم امباكشن مع بعض بتكون الدنسيتي مور. There is a sclerotic line. So this is a fracture of the neck of the femur. طيب اتكلمنا عن المينيسكس قلنا النورمال بتكون باو تايب. This meniscus is normal or not in the image? This image.
Hands are hyper intense.
Yes. Where is the hyper intense? Yes.
In the meniscus angle.
Yes. لاحظ إنه هنا كانت هي باو تايب بتكون totally black like this. لكن زي ما قالت في شنو hyper intensity line this. But this is the indicating there is a شنو yes there is a tear. There is a tear in the meniscus. So a meniscal tear can be seen when there is alteration of the shape or when there is a signal. أكتر حاجة بنعرفها إنه بالسيجنال بيكون في abnormal signal high signal. لكن in the normal بيكون totally black. فلما نلقى linear hyper intense line crossing the meniscus, this indicates إنه there is a meniscal tear. Meniscal high signal not disturbing the articular surface are caused by intersubstantial degeneration. يعني ايش؟ يعني احيانا بنلقى سيجنال لكن not crossing the meniscus. بنلقى مثلا واحده بنسميها شنو interrupted او not crossing، يعني not crossing from the whole meniscus. دي تكون due to degeneration not due to شنو tear in the meniscus. So the difference between the tear and degeneration of the meniscus, the tear running across the whole meniscus يعني from the edge to edge، لكن the degeneration not disturbing the articular surface يعني ما بتصل لنهايته كده. لكن both characterized by abnormal signal. تكلمنا على ACL and BCL. This is a BCL and this is ACL. This is BCL and this is ACL. But this is a normal. This is normal. ACL بيكون linear of no signal بتكون black. طيب what do you see? This is normal. Is there any abnormality in the image B? Compare between the normal and abnormal.
Yes.
torn.
Which one is torn?
The
Yes, يعني which ligament? I mean,
cruciate ligament.
crochet. Which one? And then
ACL.
Anterior cruciate.
Yes, anterior cruciate is disrupted. يعني حتى بيبقى في signal بيبقى bulky. So this is a torn anterior cruciate ligament. Anterior cruciate ligament tear can be seen as when we do not see the ligament totally. يعني احيانا بنعرف انه torn كيف؟ انه الليجمنت ما بكون زي ده الحين ذاته ما مبين، distorted المنطقه بقى abnormal signal و distorted totally not seen. يعني هسه الحين ما شايفين الهايبو انتنس لاين دي المنطقه الخط الاسود خالص دي. and sometimes you can see only signal. يعني تلقى signal في ACL also. This indicating there is a tear in the ACL, high signal, or totally not visible زي شنو the ACL. الكلام الباقي ده كله بس انا عملته السنه دي تقريبا ليكم للكلينيكال. انا كثير يتواصلوا معي بيكون عندهم مشكله في الريبورتنج. يعني انا عشان كده قمت عملت السلايد دي help you in your future. يعني how to interpret the fracture or the bone fracture. يعني you have to look to the anatomy. Where is the fracture? Is it in the يعني you have to describe the fracture by location, which bone is affected. يعني مثلا in the distal tibia or proximal femur, in the metaphysis or diaphysis. Is it this fracture, is it complete or incomplete? يعني involving the both cortex or incomplete. زي في البيدياتريك زي الكرين ستيك which involve one cortex but the other intact. Orientation of this fracture, is it transverse or oblique or spiral? الترانسفيرس بيكون اللاين بيكون transversely running. oblique بيكون with angulation. السبايرال بيكون helical يعني كأنه حصل له شنو rotation كده بعد الفراكشر helical in shape. هل في displacement؟ الديسبيسمنت may be rotated along the axis يعني بيحصل له rotation around the axis أو في angulation towards left side or right side يعني يسموه axial angulation أو lateral movement of the bone displaced laterally or medially أو في displace of الفراجمنت ذاته may be displaced. يكون في impaction of the two fragments أو distortion or elongation يعني space زادت between the two fragments. كل الأشياء دي المفروض to be you have to comment about it. طبعا احنا عارفين إذا عندنا fragment bone fragment ممكن تكون comminuted fracture in which يكون عندنا two fracture lines معناتها عندنا three fragments. two lines معناتها عندنا three شنو fragmented bone. فدي بنسميها comminuted fracture. لكن إذا عندنا two اقصد لا معلش الكوميونيتي فراكشر بيكون مور ذان 2 يعني عندنا 3 مثلا 3 لاينز لكن عندنا شنو؟ اذا عندنا 3 لاينز معناتها هيكون عندنا مور ذان 2 فراجمنت. يس ايوه هيكون عندنا يعني 4 اذا عندنا 3 لاينز اكيد هيكون عندنا 4 فراجمنت يعني مور ذان 3. اذا عندنا 2 لاينز هيكون عندنا يعني 3 فراجمنت فدي بنسميه segmental fracture. Also if there is a soft tissue بنعاين في area of the fracture في soft tissue. هل في open fracture يعني bone penetrated the skin and seen outside or closed fracture يعني fracture within place not penetrated the skin فده بنسموه closed fracture. ثاني واحدة من the fracture اللي هي الجروس بليت fracture اللي هو السالتر هاريس classification ده اتكلمنا عنه باستفاضة. Also you have to know how to classify the fracture in the pediatric age according to Salter Harris classification. زي الروتيشن اتكلمنا عنه. الديسبيسمنت ممكن يحصل لنا روتيشن يعني around its axis او يحصل angulation انجل زي دي او يحصل transition laterally زي دي او impaction. لاحظوا الامباكشن بيكون الميديال اند الفراكشر فراجمنت بتكون شنو حصل لها شنو تداخل في بعض كده فده اللي بيعمل لنا alteration of the normal trabeculation او بيعمل لنا sclerotic line. برضه sclerotic line usually due to impacted two edges بتكون مع بعض عشان كده تصل لنا as the sclerotic line on the plane X-ray وبيحصل alteration of the normal trabeculation. dislocation increase the joint spaces. السبايرال فراكشر لاحظوا السبايرال بيكون شكله كيف هيليكال يعني بعد ما يحصل الفراكشر كانه بيحصل روتيشن كده. اللاين دي يو كان فولو ذا لاين بتعمل لنا كانها هيليكال شيب. او الاوبليك فراكشر بيكون ويز لاين. اللاين بيكون شنو الترانسفيرس عم بيكون اللاين ليس ذان 30 وهنا بيكون مور ذان 30 ان ذا اوبليك يعني بيكون بدون اللاين دي بتعرفوا انه هو running obliquely او horizontally كده بيكون شنو transverse. فall this slide الاخيره دي كلها for your feature يعني انا جبت عليكم to help you in your يعني reporting the X-ray يعني دي الاشياء اللي you have to comment about it. Do you have any question?
Thank you, doctor.
Thank you for your attendance. السلام عليكم ورحمة الله.
يعطيك العافية دكتور.
عافيكم.